continued engagement beyond this week. I hope that you will use it for professional purposes and use that to also strengthen the bonds amongst you. So you can scan the barcode to join the WhatsApp group. So thank you to your colleagues who have put that together. I think the lead for the group is the young man coming. No, we must celebrate our people. So we celebrate you for taking the initiative. Good job. All right. So this is not administered by Africa CDC. This you're managing by yourself. So maybe to provide some logistics details before we go into the session. Like I said, we will try and finish all we have to do by 5 o'clock so that you can then go to the hotel, change, and come back for the cocktail. So the buses will be available. And the cocktail is here, but I'm not sure whether it's this room, but we'll confirm all of that to you as well. Okay, so 1 minute. Maybe I should also speak a bit on the social media engagement. So if you look at the social media engagement that we're trying to do, we're not just saying, oh, there's this session, or, oh, nice pictures. And all. No. The idea is that we're also putting content. Some of the conversations we're having in the room, we're putting on the platform so that we can also use that to elicit engagement or to elicit response from the people and to foster engagement. So we encourage you, All right, so we encourage you to please put your opinions, your perspectives on the issues that we've discussed. I mean, I thought the 2 sessions we've had today have been excellent. I mean, excellent sessions. And I see that there's a lot that a lot of you are talking about in terms of the public health research as well. And I think there are things that you should put on the public platforms. I think that we're not speaking up enough. And if there are organizations that want to support issues like this, some of the things they also want to see is what is the appetite. And I'll be completely honest with you. When the session on research started, I thought maybe there was not much interest in the room. I thought there was not much interest until we said question time and, that number of hands went up. And I saw quite a number of people, of the participants who came up even after the session to say, oh, because I was saying 1 minute, they didn't speak because they had a lot to say. So these platforms are for things like that. If you do not speak up and people don't see that this issue is something to begin to address, they probably will not consider it important. So, and CPHIA is an international conference. The whole world will be here this week. So if you tag the CPHIA handle as hashtag, this also becomes a part of the main conversation at the conference. So we have to be strategic, Hashtags are not just hashtags. They are not just hashtags, It's for many organizations, those kind of things, they keep an eye on them to know what people say on this issue. So please keep an eye on that. We encourage you to do it. Take pictures. Pictures are fine, and all of that. But put some real content online as well. That's also how people identify you. Now, this is a... sorry, because we created, I'm told that the Africa CDC has created a platform as well. So please kindly put this on. And sorry to the colleagues, I think that That was not communicated earlier. So now that we have that, Rotimi, can we start, do something very quickly? And then, yeah, please, let's welcome Rotimi now back as a game master.
Thank you very much. All right. Before we go to the game, we're going to form a beat. Huh? I'm going to teach you how to form a quick beat, and then we'll come to the game. We're going to form the beat with how the heartbeat sounds, how you sneeze, and how you cough. Huh? No, we're not sharing COVID, don't worry. All right, so when I say give me a heartbeat, you know how the heartbeat sound? Boom, boom, right? So give me a heartbeat, boom, boom. I can't hear you. Give me a heartbeat, boom, boom. Yes. And if I say, and a sneeze, axing. That's what a sneeze sounds like, right? So give me a heartbeat. Give me a heartbeat. And a sneeze. Axing. Ha. And then the last one is, I say, and a cough. How does a cough sound? Aha. You people are expert coughers. If there's any word like that. So, give me a heartbeat. Hey, I can't hear you. Give me a heartbeat. And a sneeze. I can't hear you. And a sneeze. And a cough. Okay. So, we'll take the three together. If I say, give me a heartbeat, you say, boom, boom. And a sneeze. Boom, boom. And a sneeze. Boom, boom. Can we do that? Can we do that? All right. 1, 2, 3, go. Give me a heartbeat. Boom, boom. Give me a heartbeat. Boom, boom. And a sneeze. Boom, boom. And a sneeze. Boom, boom. Then the last one, we're going to add a cough. Right? So it goes like this. Give me a heartbeat. Boom, boom. Give me a heartbeat. Boom, boom. And a sneeze. Boom, boom. And a cough. Boom, boom. Now we're forming a beat, right? Good. So let's take it together. Give me a heartbeat. Give me a heartbeat. And a sneeze. Boom, boom. And a sneeze. Boom, boom. And a cough. Boom, boom. Now, that's how to do Niger music. You guys are perfect. A round of applause for yourselves. So we go to Kahoot very quickly, kahoot.it, and I see some people are very fast. The only time when we see some people's name is here. When we go to leaderboard now, your name disappears. So this is your moment of fame. Let's see your name here. Wait for 1 minute for you to join. Your moment of fame. Your name comes up on the board. And then we do our 10 or 11 questions very quickly before I get off stage. Let me see, we have 64 people now. If we have about 70, we would start. Okay, I see that we have hit 70 people. If we should wait for you, say nay. I can hear like 1 or 2 nay. Okay, I'll wait 5 more seconds. In my former life, I was an opera singer. Should I perform for you? When the dog bites, when the bee stings, when I'm feeling. That's not my job today. We go back to Kahoot. All right, so let's start. Ladies and gentlemen, we're about to start perhaps the final version of Kahoot today. In 3, 2, 1, we'll reveal the first question for today. The head of Project Strengthening Crisis and Pandemic Prevention in Africa at GIZ Africa Union is? It's in your program. Clue, it's in your program. It's in your program. The gentlemen have been coming on stage very often, all of today. None of the above. Now let me see the leaderboard. Some people are just guessing. It must be Uma Onyango, Kenyan. That's him. You're wrong. Let's go. Let's see the leaderboard. Let's see the leaderboard. Can you move your cursor up? Victor, can we see the leaderboard? Okay, now we have AY, Fa Yusuf, Ademola, Nene, Rwanda. Ademola, you want to win again, not this time. Okay, let's go to Dr. Nafisha Chotun is the Technical Manager, Africa CDC. It's also in your program. Technical Officer, ENTD, Africa CDC. Chief Vaccinator, Cairo Institute of Commerce, or a Professor of Linguistics. It's in your program. Many of you got it correctly. That's good. But let's see whether you are one of the fastest fingers here today. Let's go to the leaderboard. AY is still leading. Fa Yusuf is 2. Ademola is 3. I want you to kick out Ademola from this leaderboard. Rwanda is 4. Hortensia is 5. Let's go to the next question. Question number 3 of 10. Somalia shares maritime border with one of these: Yemen, Ethiopia, Mali, or Libya. Should I give you a clue? In 3, 2, 1, 0. The answer is Yemen. Maritime border, not land border. Okay? So let's move to let's see the leaderboard. Let's see the leaderboard for a second. Ademola is about to be pushed out of here. I'm very happy about that. Hortensia is leading now, getting AY, Fa Yusuf, Ademola, I don't want to see you here. Next question. In the 2002 Winter Olympics, which country won the largest number of gold medals? China, United States, Ouagadougou, or Norway? I'll help you out. Ouagadougou is not a country. If you pick Ouagadougou, we'll send you packing today. If you select Ouagadougou, 2 people selected Ouagadougou after I warned you. Who are those? Where's Demola? He's gone. I'm very happy about that. Okay, Hortensia is still leading. Rwanda is number 2. Getting Mike AY. Because we're in Rwanda, Rwanda wants to win. It's not possible. That won't happen here. The longest African river which empties into the Indian Ocean is called the Zambezi, River Nile, the Shebelle, or River Congo. Huh? Some of you are even wondering, where's the Indian Ocean? Okay. The answer is the Zambezi. Some of you are good at guesswork. You didn't know it, you just picked one. Hey! Okay. Next, let's see the leaderboard. Aha! Rwanda is falling. Rwanda is falling, maybe to fall off from here. Hortensia is still leading. Fa Yusuf is 2. How did Demola come back here? Rwanda and AYP. Okay, let's go to the next question. I see there's a lot of group work where Ademola is sitting. How many member states are there in the African Union? 45, 55, 53, or 54? This is a trick question. Look at it very well. 45, 55, 54, 53. Or none of the... That's not an option here. Ladies and gentlemen, if you say 55, you are absolutely correct. Let's see the leaderboard. Can we see the leaderboard? Yes. Ademola has fallen away again. Try Ada. Where's Rwanda? Rwanda is missing. Hortensia, Fayusuf, Cherub, Gideon, Jidema. Let's go to the next question. 7 or 10. True or false? This one attracts double points. On day one of the youth pre-conference, 3 anthems were recited at the opening of the meeting. True or false? 3 anthems, true or false? Huh? Some of you are busy doing other things when they were singing the anthem. True or false? In 5, 4, 3, 2, 1. The answer is what? False. Next question. There were only 2 anthems that were sung here. I think that was the AU anthem and the Rwandan anthem. Hortensia is still leading. Fayusuf, Cherub, Gideon, and Jidema. Now let's go to question number, is that 7 or 8? Question number 8. Let's go. 8 of 10. In the ongoing World Cup, Morocco has only conceded how many number of goals? 1, 2, 3, or 4 goals? My country, Morocco, has only conceded how many number of goals? If you say 4, you are wrong. If you say 3, you are also very wrong. But let's see the answer. 1 goal. Okay? Let's go to the next question. I think that's question. Hortensia is still leading. Hold on a second. Gideon, Jidema, Cherub, Fayusuf. Ademola, where are you? You have disappeared. Where is Rwanda? We're having this in Rwanda. You cannot lose. You have to be on top 5. You have 2 more questions to go to redeem yourself. Let's go to 9 of 10. In this all, there are 3 projectors, true or false? In this all, there are 3 projectors. Underline the keyword projector, not television or screen. I'm giving you a clue, but I know some of you have already selected the answer. In 3, 2, 1, 0. The answer is false. There is only 1 projector in this auditorium. And this is the projector. This one here. All of you are counting screens. Congratulations for counting the screen. Okay, let's go. Let's see the leaderboard. Hortensia is still leading. Gideon is number 2. Who is Z that has made it to the leaderboard at the last minute? You're happy? Congratulations. Okay, let's see the last question. Let's see whether you remain there or fall off now. Benjamin is the name of the man handling the camera in the middle of the audience in the meeting hall, right side of the meeting hall, back of the audience in the meeting hall, behind the screen on the stage of the meeting hall. Don't worry, there's nobody behind the screen. Who is Benjamin? Where's Benjamin? Where's Benjamin? Ladies and gentlemen, Benjamin is the one filming from the back of the audience. Now, let's see who remains on the leaderboard. And for the 3rd position, ladies and gentlemen, we have Gideon. 2nd position, we have Fayusuf. And the 1st position, we have Hortensia. Where are the 3 of them? Hortensia? Huh? They should dance? Oh yeah, come forward, come forward, come forward. The 3 of you, come forward. Quickly, quickly. Aha, you people were cheating each other. Same table. Who was copying who? Who was copying who? Competing. Now, DJ, give me a nice song. Nice song, DJ. Cough. Which one is cough? Okay, cough. Do you have cough, DJ? Let's make this quick so I can get out of here. Should we give the winner a prize or the best dancer? The best dancer or the winner? Winner, okay. DJ, we're waiting for you. DJ no song? Okay. They will dance at the cocktail. DJ going? DJ is confused. Thank you very much. A round of applause for them. Sorry.
All right. Thank you very much, Rotimi, and thank you to the winners as well. So we're gradually coming to the tail end of our two-day pre-conference. But before we do that, we would then have the two TEDx-style talks. And I would like to invite, for the first one, Mr. Linda Nene from the International Federation of the Red Cross. The Red Cross and the Red Crescent. 10 minutes, Mr. Nene. Please, let's keep clapping until he takes the podium.
Can everybody see me? I'm not sure if this platform is too high or I'm too short. Okay. That should be good. Good afternoon, everybody. Thank you so much for having me, first and foremost. Just as the speaker had introduced me, my name is Linda Nene, and I am an employee of the International Federation of the Red Cross and Red Crescent, based out of South Africa with the Pretoria Cluster Delegation. So today I was requested by the African Union to just come briefly speak about the topic that was already started up by two of the previous speakers, actually three of the previous speakers, around community health workers as pillars for health systems in Africa. So now I'm just waiting to see my presentation on the screen. Tech, is everything good? Okay, perfect. So then I will proceed. So now, as a humanitarian agency, I'm going to focus the bulk of my talk largely about what the implications of community health workers within this space would mean for humanitarian efforts and what that translates into reality. Next slide, please. So let's start this conversation with some sobering facts, okay? First and foremost, there are over 1 billion people worldwide that cannot use health services because they are unavailable or either completely unaffordable. So there is currently an estimated deficit of about 18 million health workers, as previously stated by the speaker, in low to middle income countries like the ones that make up the 55 African Union states. Furthermore, what this translates into is that there are less than 5 medical doctors per 10,000 people within Africa, compared to the 36 per 10,000 people in Europe. This paints a very problematic and worrying picture. And ultimately, what that translates into, next slide please, is that just over 50% of the population will remain unserved from essential health services. As you can see right there, there's only about 48% of people that actually do receive these health services, which accounts to about 615 million people. Next slide, please. So ultimately, what we're dealing with is that Africa has got a very precarious risk profile, considering the information that we've already presented about the deficits that exist within the healthcare systems. And what this converges onto the continent is when we face issues such as disasters like drought, extreme temperatures, flooding, and storms, all exacerbated by climate change as it currently stands, we have increased risk and greater numbers of people in the hundreds of thousands, sometimes even the millions, that are affected by these disasters. Furthermore, a considerably worsening burden of disease on the African continent further exacerbates these disasters and their implications and presents its own health disaster that comes up as we have seen marked rises in non-communicable diseases, about 77% of which occur in low to middle income countries. There's elevated risks of epidemics and greater likelihood that these epidemics will remain protracted for periods. Furthermore, we also see incidents where there are resurgences of previously controlled infections, like what we witnessed with Malawi and the resurgence of wild-type polio earlier this year. Next slide, please. However, I'm not here to focus on the doom and gloom of what's going on the African continent, because as we are sitting here today, we are the movers and shakers of this particular continent, and we are solution-driven and solution-based. So now, key to these solutions, we are also looking at the community health workforce, as I've already explained earlier. And I'm actually here to advocate for this particularly underutilized pillar of community health workers or community health volunteers, sometimes also called rural health motivators or various things. So now, just for context about community health workers, the Declaration of Alma Ata of 1978 is one that focused primarily on primary healthcare. And it set a goal for the attainment of, by all peoples of the world, of a level of health that would permit them to live socially and economically productive lives by the year 2000, and identified primary healthcare as its attaining target. This ultimately introduces us to some of the earliest declarations that surround the concept of universal health coverage within the modern world. Community health workers are essential in achieving this an essential tool that can be used towards achieving universal health coverage. Now, when we speak about universal health coverage, we often mention this very esoteric, out there type of concept where everyone is living very happy, carefree lives and they'll be taken care of. But the reality of it is that the fact that we're having conferences like this means that we are very far, far, far away from the reality of that being something that exists. So as it currently stands, community health workers, or the community health workforce, is actually an existing workforce that has already been there. It's not a particularly new concept, but it has been invigorated within the last 5 to 10 years on account of the epidemics, the pandemics, and even increased interest within the research area about how to better strengthen these community health initiatives. Furthermore, the previously existing community health initiatives often failed, and they faced quite a number of challenges that we'll briefly glance on later on in the presentation. So some countries that have actually successfully implemented some community health projects and present an investment case for community health workforce include nations such as Botswana, Kenya, and our current host nation, Rwanda. Next slide, please. So as such, the community health workforce, by virtue of its definition, play a very critical role in non-emergent and humanitarian settings. Just the slide before that. Thank you. So they play a very critical role in non-emergent and humanitarian settings through these 7 key points. First is that they act as voices for the communities for which they serve, which is something that I believe the previous speakers have already touched on. They also serve as bridges between patients, communities, and the healthcare systems, because as you can imagine, being the foot soldiers that are actually capable of going into these communities, going into the homes, and ensuring that specific patients take their medicines, they follow up on treatments that are supposed to be done, and even liaise with hospitals for the needs and the care of patients that are out there within the actual community, basically creating a decentralized system for healthcare provision. Furthermore, they also provide services as lay counselors. Oh, I'm too far. Okay, my apologies. They also provide services as lay counselors, also as exemplified by some of the work that is done by community health workers who are trained by the Red Cross, wherein they are able to provide psychosocial support and psychological first aid in emergency situations. Furthermore, they also run campaigns to mobilize community members for health services, and they also work towards targeting households for specific healthcare services vis-a-vis for triage. And most critical to humanitarian settings is that they are vital in conducting critical emergency response services, which is identification of people that need care, providing services during acute and protracted crisis, which will include conflict, insecurity, and population displacements, as we are witnessing within Namibia and Angola at the present moment due to the drought. Next slide, please. So the community health workforce in action is essentially when we get to see strong healthcare systems that have the community health workforce integrated fully into it. The one key distinguishing feature of a strong healthcare system is that the community health workforce is actually indistinguishable from the rest of the healthcare system, and is effectively an extension of the entire healthcare system that is then able to reach the community members. Community healthcare systems develop and strengthen community health overall and provide a continuum of care that is made by an expanded human resource that remains embedded in communities despite various changes like disaster. So they are there before, during, and after such responses occur. An example of this I can provide is when I was part of the KZN flood response this year in 2002, when KZN had a horrible flooding situation where about 400 lives were lost and thousands of people were displaced. Many people within this particular event had lost things like their prescription cards, clothing, documents, and basically had lost all sense of human dignity. Critical to the way that the community health workforce was able to respond in these particular things was that they were able to help the people that were the affected populations in prioritizing their most critical needs and ensuring linkage to healthcare systems and other services within government agencies. The affected populations of these things often deprioritize their health in search of things like food, shelter, and personal security. So most times, community health workers can then function as buttresses when these incidents occur, and they provide holistic care to those that are in need. Next slide, please. So as it currently stands, we then question, and we are working towards understanding and establishing what exactly is it that makes a sustainable community health workforce. We are looking at things like national stewardship, which effectively reckons with the fact that governments do have to actually take priority and take custodianship of these particular community health initiatives. Because one of the key things that used to result in failures of these community health initiatives is that they were donor-driven, and more often than not, once donor interest has been divested from a particular place, we would lose these particular programs, and these populations would often still need care going forward. Furthermore, we also need to see embeddedness and integration of the community health workforce within the primary healthcare services and within the greater scheme of the healthcare services and policies and programs to ensure continuation of care and fulfillment of their services. Furthermore, cadre and role definition is something that has become quite a contentious talking point at this particular junction with the development of community health workforce. And I believe even going forward into the conference, this is going to be one of the many key areas that we have to discuss about how exactly community health workers are going to be defined. Are they defined as volunteers? Are they defined as staff? Are they defined as etc., as whatever it is that you could possibly imagine. So it's actually very critical that even within the 55 member states, conversations like this at ministerial level and at policy level are had to ensure continued care through community health workforce and ensuring a healthy and happy workforce within community health workers. Furthermore, there is need for three key areas, human resources and management, as well as financing, to ensure the sustainability of these programs, because as you can imagine, without these particular aspects, you can't necessarily have anything without proper management and without proper health financing. Next slide, please. So which brings us to where we currently stand between the International Federation of the Red Cross, the African Union, and the Africa CDC. So currently there is the Saving Lives and Livelihoods initiative, or as I'll continue to call it going forward, the SLL program, which is a collaborative effort between the MasterCard Foundation, Africa CDC, and the African Union, supported by the International Federation. So the International Federation of the Red Cross provides technical support through its Red Cross national societies, which are auxiliaries to the government vis-a-vis an extension of the government formed by acts of parliament, which allows them to have unfettered access towards that particular government and ensuring advocacy and negotiation that is much more streamlined and easier managed through the IFRC and its Red Cross national societies. So the IFRC provides support within this program through areas such as health, which I am involved in, protection, gender and inclusion, as well as risk communication and community engagement. So the ambition of this particular SLL program, it actually has a very ambitious target to recruit about 2 million healthcare workers across the 55 AU member states, and that is expected to occur between 2022 and 2026. This is a program that is already in the process of actually being rolled out, and one of the major lead applicants within the Red Cross movement is actually the Botswana Red Cross, which is the lead applicant that has currently decentralized the program towards other applicants, and we're in the process of micro-plannings and ensuring implementation of this particular project. So the idea is that each of these 2 million community healthcare workers would then be able to support up to 250 people at a time. What that effectively translates into is a total scope and reach of about 500 million people on the continent that can be ushered towards and assisted through the community health workforce, which bridges the gap between the serious problem that we had already stated earlier with about 52% of the current population not having access to care. So ultimately, what we expect this to translate into is a horizontal, multifaceted program that maximizes benefit that vertical donor-driven approaches towards community health programs could not achieve. Next slide, please. So this concerted effort for the protection of health achieves what I would like to consider a community of practice. A community of practice that is driven by knowledge generation, evidence, of course, coming from that particular knowledge and how to use evidence-based approaches, information management, because as we had already stated earlier, community healthcare workers are an actual vital source of data to these communities, and we are able to get to the grassroots levels and even last mile communities to figure out how best we can assist them and provide information on what's actually going on. They form part of issues like community-based surveillance and etc. Furthermore, problem solving is also an aspect of that in utilizing evidence-based data. And lastly, one of the most key aspects, which I believe the people within this room right now are prime positioned to advocate for community health workers and speak very proudly and loudly about the use of primary healthcare services. I would actually like to make an example of the fact that earlier this year, we actually had the privilege as the IFRC to support the Palali Eswatini Red Cross Society in an opportunity to engage with civil society organizations ahead of the UN high-level meeting in 2023, I believe it will be in September, around universal health coverage. So the findings of this were actually supported by the community health workers, and they were able to give feedback towards these systems. Next slide, please. So why exactly this matters is that programs such as this are ultimately representative of us as Africans. So it gives me great pleasure to actually see so many youth taking up the mantle towards pushing community healthcare workforces and striving towards the new public health order, because we are ultimately the movers and shakers on the ground. So the Bingwas, doctors, nurses, scientists, pharmacists, and various experts within the field that are present in this very room right now, you are the custodians of this program and the future of Africa in attaining universal health coverage for all of its citizens. The youth are Africa. Thank you so much.
Thank you very much, Mr. Lindal Nene. And I apologize that the first time I saw your name, I made some assumptions. Those which I regret so much now. But thank you. That was a very profound presentation. Thank you very much, Mr. Linda Nene. Put your hands together again for him. Let me invite the second speaker, Ms. Rebecca Sherop. Ms. Rebecca Sherop is a mental health champion and founder of the initiative, The Semicolon. Let's put our hands together for her as she makes her way to the stage.
Hi, everyone. We're youth, right? Yeah, and we're energetic, right? Yeah. My name's Rebecca Cherop. I am from Uganda. I am a mental health champion. I'm a writer, and I'm a bingwa. Yes. Yeah, so you can all see me say that with a smile on my face. I'm so excited talking about myself like that. And I know so many of you are doing great work out there. Yeah, good job. But what you may not know about me is that I have lived experience with mental illness. I was diagnosed with anxiety, depression, OCD, and post-traumatic stress disorder. But hold that for now, right? So I'll take you back on a journey. I would like you to relive a journey with me that molded me into the person that I am today. So it was back in 2000, and I experienced loss. So I lost two of my most important people in my life. And as a child, I was 5 years old. Don't count my age. Yeah, so as a child, I struggled with childhood disorders because of the trauma. You're dealing with grief as a child. You don't know who to ask questions. In our African culture, we don't tell children about death. Yeah? I mean, you see people grieving at home, but you see your grandparents grieving, your siblings, but they don't tell you what exactly has happened. And so we leave children on their own to figure out life. And so was that. And so I dealt with childhood disorders. For those that don't know I don't know if, do you know childhood disorders? You see children who don't eat. There's sleeping disorder. There are so many, you can Google. We are youth, we love using the phones. And so 17 years later, just immediately after I completed campus, I'm one of those young African people that got a job immediately after campus. And so everything was moving on well until I found myself sad. I was angry, I was not happy, but then you'd always see the smile on my face. And I was afraid to talk about what I was dealing with because there's so much mental health stigma that we have in our communities, in our families. You just can't tell somebody that you're not feeling well. You don't talk about those things. And so, luckily, it was so bad that I was suicidal, but at that time, I was very lucky that I landed on a friend who was a psychiatrist. And that's how I started my treatment and the recovery journey. And now I'm here. I'm so hopeful about life. So why am I sharing my story with you? I'm sharing my story with you because I believe that every one of us has a powerful story. We are over 200 here, and everyone has a unique story, right? If you don't have a story, then I don't know why you're alive. Yes, we all have a unique story. And our stories are powerful in whatever way that you may think. You're so small, you're just a young person, you're a youth. Our stories are powerful. And our stories have power to give hope, they change perspectives, and they have power to influence policies in our communities and in our countries. Now, I don't know if many of us are aware, but we're really doing bad. I don't want to paint a good picture, but statistically, research has been made, and the World Health Organization tells us that 1 in 4 of us has a mental illness. Now look at your neighbor right now. Yeah, so many of us here right now are struggling, but you're in denial. Or even, you might not know because we don't have the right information. Yeah? We don't have information. And so what I urge you today is Google, read about mental health, find out and know what exactly mental illness is. You might be struggling and you actually need help, but you're not aware. So my story and my experiences birthed in me the zeal to found the Semicolon Nation, which we do a lot of advocacy, community advocacy in creating awareness about mental health, and now digitally going to, talking about mental health and sharing stories. And what we do mostly is we document stories of people that have dealt with mental illness. And so this gave me the courage to actually share my story in a book that will be out soon. Yeah. So just to show you a picture of what exactly is happening. Africa has the youngest population in the world. We are over 1.3 billion people. And Africa, actually, where I come from in Uganda, we have the youngest population globally. 77% of us are below 24 years old. And globally, Africa has the youngest population. And when WHO tells us that the second leading cause of death is suicide amongst people between 15 and 29, that means that we're actually doing bad. But no one is going to talk about it. What will we do when a 7-year-old in our community commits suicide? What are we doing? What are you going to do? Do you have an answer to that? Are you that person that somebody will walk to and be able to open up and share their stories with you and share their struggles with you? Are you kind enough to be there and be that person that the community needs? So I'm going to end with a quote that I use so much in that drives me on a daily basis to do the work that I'm doing. The projection, I don't know. And so what I wanted to just ask you today is, what is that one thing that triggers you to do the work that you're doing? What is that thing in your community that makes you want to do something? And I just want you to think about it for a second and think about your community, your village. It doesn't have to be your nation, your country. That's so big, yeah? But think about your family, for example. What do you want to change in your family? What do you want to change in your community? We're all leaders, that's why we're here, right? Right? Yes. And so think about that one thing that you'd want to change in your community. What is triggering you? My experience has triggered me to be doing what I'm doing today. What is that one thing? Is it your story? Is it your academics? Is it your I don't know, anything? You can use anything to change and cause positivity in your community. So you need to fight. We can't wait for our leaders to do everything. We can't wait for our state and presidents to do everything for us, but the power is in our hands. And like the previous speaker said, Africa is the youth. It's us. Thank you.
That was a powerful one. Let's put our hands together one more time for Rebecca Cherub of the Semicolon. Thank you. Thank you very much. And the reason why we've put this particular topic on the agenda is also because the Africa CDC has just recently adopted the Africa CDC Non-Communicable Diseases and Mental Health Strategy. This is already on the Africa CDC website, so please get yourself acquainted with it. It also provides guidance on what you can do in your various engagements on mental health issues. This is important. It's a big deal. And it's important that as we do our work as professionals, young health professionals, we also take care of our mental health. We are all in this together. We would have an input, a mentor's input. And I'm looking at technical to give me a signal that we're set. This is one of our ideas to also allow you interact and listen to Africa's top public health professionals who continue to make change in the various spaces that they occupy, but also try as much as possible to bring along young people in the work that they do. So we hope that we can get this sorted in a few minutes while the colleagues who will do the Bingwa information session get set. So we will be live in 2 minutes. Ladies and gentlemen, we are very honored to have joining us virtually today one of Africa's foremost public health professionals, a leading voice on issues relating to public health, and a frontline leader on the continent and globally on public health, Dr. Gitinji Gitai, the Global Director of African Medical Research Foundation, AMREF. Let's put our hands together. I believe that in just a second, it would be up on the screen. I'm getting signals. Okay, I mean, for many of you who do not know the African Medical Research Foundation, AMREF. AMREF is a global organization that actually started here on the African continent. It's in various countries on the African continent and globally, including in Europe. And they provide and work on several issues, including pandemic preparedness and response, community health, youth engagement, and many of the topics that we've discussed over the last 2 days now. It is my understanding that we are set. Okay, I need to improvise a lot more. Okay, sorry about the technical itch. One of the issues that we discussed was the need for networking. And this afternoon, just before the closing, in about 15 minutes, we would have a small networking session, which has been organized. The idea is to also make sure that for those of you who have not had a chance to interact with people from a different country than where you come from, you are able to do that before we formally close the session this evening. And after that, we would close, and then we would come back at 7 o'clock for the cocktail. The cocktail will be held in the hall here. So please join us. We can go to the next agenda if Technica is not ready, and then we come back later. So next agenda. Thank you very much. All right, ladies and gentlemen, can I invite the Bingwa team for their information session? Are they ready? Okay, now they are nervous. So we have, all right, ladies and gentlemen, we go back to the plan as we have it. Put your hands together as we welcome Dr. Gitinji Gitai of the AMREF, the Global Director of AMREF, who is joining us right away. Thank you very much. Yes, Dr. Gitinji, we can hear you. Thank you for joining us. We have 200 participants drawn from about 40 member states of the African Union in the room. They can hear you loud and clear. We hope we can solve the visuals shortly, but we hear you loud and clear. We've been here for the last 2 days discussing meaningful youth engagement for advancing sustainable health security in Africa. Thank you for making out time. We know we came to you very late for this, and we appreciate your time. So you have the floor.
No, thank you. Thank you very much for giving me the chance to comment. I wish I was in Kigali before, but I arrived tomorrow. So as you can tell, even the way I'm dressed, I'm actually traveling from our country, going home to prepare, and then I travel tonight to Kigali. So I hope to see many of you tomorrow. But I would like to thank you first, and thank Africa CDC for getting all these young people in the room, and I hope that the deliberations have been fulfilling and productive. The one thing I want to say is that I always feel like we should actually shift gears to meaningful population engagement, because when you look at the population of this continent, it is 75% youth. So it sounds to me every time I hear meaningful youth engagement, youth is different from the population, but actually 75% of the population in this continent are youth. So that's the first thing I would like to say. And if I say that it is really meaningful population engagement, then the question to ask is, what does the biggest part of this population do for securing health security for the future? Health security has many things has many dimensions. And of course, the first dimension is the health of the people. As we keep saying that 80 to 90% of people are born healthy, only occasionally do about 10 to 20% fall into illness and then revert back to health when you have a good health system. So the first thing about building health security is protecting health. It's actually defensive defensive security, maintaining health, and ensuring that we defend health. And how do we defend health? In my view, the most important thing we need to do is ensure that people are living healthy lives that are economically and socially enabled. And that reflects on all the areas of economic and social enablement or empowerment, which talks about education, for example, making sure that people are educated. If we can educate 99% of our population, then we've achieved a big goal towards health security. The second thing after education is obviously providing the means to realization of people's potential. These things include water, sanitation, and all the other things that we need to be healthy. And that means that if people are healthy and they're constantly living in a healthy environment, then the next part is to ask, so if there was a risk or a threat, are we prepared to respond to that threat? And that now is the resilience of the health system. Is the health system able to respond to a threat so that the threat remains contained? Because as with every health threat starts with a household, with a community. So the question is, how enabled is that community to respond to the threat at the source? That talks about resilience of community health system, resilience of individuals and households, resilience of the health infrastructure, resilience of science and commodities that we need to keep people, to keep the health system responsive to those needs. So all these resilience has to be built on a civil engagement, on a human rights agenda, on an equity agenda, on a health system, a financial system agenda, and on a health agenda that is responsive to the people's needs. And that's primary health care, largely, which is looking at how people are enabled through education and awareness, how they can actually engage at a multi-sectoral level, which is what we need to talk about, veterinary level, environment, agriculture, education, all these elements that form the multi-sectoral basis for health society. And then, of course, when people are sick, that the primary care is able to respond because it's properly enabled and capacitated. So for all of us in this room, you can see where your role is. Your role is first maintaining health from a defensive manner, defending health, and secondly, offensive, ensuring that you actually are able to build responsive systems that are resilient. And of course, many of you will be health workforce, others will be leaders, politicians that are making policy, others will be activists that are demanding the rights from the duty bearers. So there are many roles for each one of you, and I hope that these deliberations have been fruitful. So I think, Fred, that's what I would like to say for now, but we need to keep our mindset in the future in how to actually do meaningful population engagement, because the population of this continent is now all youth. The rest of us, those of us are 52 now, we are minorities. It's actually about the majority, and how the majority take leadership for health security. Thank you very much, and I hope to see some of you in Kigali when I land there tomorrow. Thank you for the opportunity.
Thank you very much. Let's put our hands together for Dr. Gitinji, Dr. Gigi, as most of us like to call him. Thank you very much. And for the great reminder that what we are doing, yes, we tagged it the Youth Pre-Conference, but sitting in this room are the future Dr. Gigi's, Dr. Uma, Dr. Nkeka Song, Madam Bianyima. So you are the leaders that we are waiting for, as we say it. And that whatever you do, it does not just have implications for young people who are 65%, as Dr. Gitinji mentioned, but for the whole of the society. So we must take our responsibilities seriously. So once again, let's put our hands together for Dr. Gitinji for that input. Thank you very much. Now I'd like to... Yes, we hear you. What a way to close that. Thank you very much, Dr. Gitinje. All right, we're coming to a tail end. We would have to skip one of the agenda, but now I invite Dr. Chris for the AU Bingwa information session. Like we mentioned yesterday, you've heard a lot about the Bingwa, but we know that not all of you are familiar with what the Bingwa initiative is. So we would have a short session on the Bingwa initiative. So Dr. Chris, you have the floor.
Thank you, Sanusi. I prefer this mic than, I don't like that, sorry. I'm here just to, I know we've been talking about the Bingwa initiative so many times yesterday, and I don't know if everyone in the room know what the Bingwa initiative is. Okay, those who doesn't know. I'll point someone and ask. I will not ask. Yusuf, I know I will not ask you, you know what it is. So the Bingwa initiative is a COVID-19 initiative, if I may put it like that first. It's an initiative that Africa CDC came up with in February, this year, February 2022. The main objective of the Bingwa initiative is to bring young people in the fight against COVID-19. So when this initiative started, it started in, as I said, in February 2022 when it was during the AU summit where head of states, they met to discuss about the role of the situation of COVID-19 on the continent. And it came up that looking at the situation and even now, Africa is the continent which is less vaccinated. And the gaps was going like big and big, and as of now, if you know, the rate in Africa is less than 26%, when in other country or in other continent we have reached already, they have reached already kind of 60, 70%. So the initiative was to engage young people in the fight against COVID-19, in recruiting young people in their community, train them, and deploy them in their community. And what they've been doing in the community is to mobilize their community, encourage them to get vaccinated. Because we all know that, and Bitanya said it again yesterday, Africa is made up of at least 60 or 60% of young people. And if these young people are not vaccinated at the rate, and we all know, who knows the rate that we need to reach for the vaccine, the coverage of vaccination on the continent? What's the rate we are aiming to? Hello? What's the rate? Yeah. What is the rate we want to achieve in vaccinating people? People know, but they're not responding. I know you're tired, so I'm trying to make it very short and bring my people in. So we are looking at vaccinating 70% of the population in Africa, but as of now, we are only about 26. And this is very far from our target. And this is why the Bingwa initiative has been brought in to now bring the young people. And as I said, Africa is made of 65% of young people. We need those young people to be engaged in this fight against COVID-19. We started engaging young people, and the first training was last week, 2 weeks ago, in Tanzania for the Eastern region. The second phase will be it's next year, but also next month, January, for the Southern region. And we are looking at covering the 5 regions of the continent in recruiting, training, and also deploying these young people in their community to be championing the vaccination. So every time when we be hearing about the Bingwa initiative, as of now, we are looking at those who are championing COVID-19 vaccine in their community. But Sanusi said it, the initiative is looking at becoming a bit trying to address all the issue in terms of public health issue when it comes to young people. So I don't want to take it very long. Maybe we will have time again to share the information in the WhatsApp group that has been created. Wamweni, can you confirm that it has been shared? The link for everyone to join. Yes, I think they will project it for everyone to join via that link, the WhatsApp group. Okay, this one. Please scan it and join, and in this group we'll be sharing all the information needed. Not only, I'm just mentioning the Bingo initiative, but this is all the information we'll be sharing regarding young people on the continent. So, before I ask for the presentation, let me please invite two colleagues for 2 minutes. Do you allow me, dear moderator? Dumsani Mamba Jobo, please come forward. Dumsani is going to talk about, in 2 minutes, 2 side events that is going to happen tomorrow. And if you're interested, you can join. Please, can you clap for him? Try to encourage him. This guy is very shy. He needs some encouragement. Thank you so much for coming. Can you please tell us?
Hello. Good afternoon. I think this is the longest walk I've ever done in my life. But the most encouraging thing is you are looking at very committed, good-looking, and well-relaxed people. Well, I'm going to speak briefly about a couple of things. The Chief Bingwa here said 2, but I would want to, just for the interest of everyone, and say 15. From Africa CDC's perspective. We have a lot of side events. It's like you have a full course meal and then you've got lots of side dishes, desserts, which are all served by Africa CDC in different thematic areas. But out of interest and curiosity from what I've been hearing in the room, and I think Sanusi highlighted in one of it, I'm a mental health technical officer, so I'm going to be biased a bit and lean towards the mental health aspect. To start with, tomorrow morning at 9 at KCC, which is the Kigali Convention Center, MH2, which is main hall 2, we are having a discussion on what he spoke about, the recently launched Africa CDC strategic plan on non-communicable diseases, injuries, and mental health prevention, where we are going to be speaking about the implementation. We've got lots of documents at continental level, but we now need to make the documents active. One of the people we spoke about as we were developing the document said, it's a very beautiful document for as long as it will not be a briefcase document. And we are inviting all of you to help us unpack this document and not make it a briefcase document. And then in the afternoon, there's also another activity happening at the auditorium 4 in the very same KCC, which is on mental health, particularly depression. She spoke about her life story. This one focuses on findings on a study we did on depression using an Africa-developed screening tool for depression for children particularly. So if you want to learn more about that, you are welcome, you are invited. The afternoon session is at 3 o'clock at Auditorium 4, and I'll be very happy to see all of you there as we discuss depression screening for children and all the other side events happening. It's a buffet. Thank you very much.
Thank you so much, Msani. Can we now go for our slide, please? 1, 2, 3. Okay, thank you. Let's go.
Oh, this rain. Hope it stops so that I can reach the hospital early. Hoga, how are you?
I'm good. Misha, how are you?
Where are you going?
I'm going to the hospital to see my fiance.
Oh, which hospital?
I'm going to the referral hospital.
Oh, that's the same hospital that I've admitted my uncle.
Oh, really?
Yes.
We were on a date and my fiance was coughing, so I drove her to the hospital.
Oh, those are the same symptoms and signs I saw with my uncle. He was
Well,
coughing.
I hope they feel better. Let's
Hope
rush.
so. Let's reach to the hospital. Oh, Morga, I've seen my aunt. She's crying.
Wait, this is my mother-in-law.
Auntie
What's wrong,
Jamila?
Mom? Is everything
happened?
okay?
Mbishi, it's your uncle. He has passed away. Oh my God.
Oh,
My uncle.
my fiance is also gone. Hey, now I've lost the love of my life. Oh, I'm going to miss my fiance.
My son, my daughter. The doctor said there's nothing they can do. Oh my God, we have lost her. We have lost her.
Oh, I could have even caused this. I did not vaccinate.
Oh, it's such a pity. I'm just looking at my uncle lying down there. I can't even go and bury him because of the government restrictions. I can't even be there and say goodbye to him. Oh, COVID-19.
Oh, I've lost the love of my life. What am I going to do? We were planning to marry in January 2023. Now she's gone. Oh my God, this is so sad.
So, this is so much pain for us. We have lost our loved ones. So I had to go and get vaccinated. Next slide. I want to tell someone in our community. I want to share the news, everybody to get vaccinated. I want to get involved. I want to save my community. I want people to know about COVID-19 vaccination. So my family members got vaccinated. In my community, I engaged with them and I shared the news about COVID-19 vaccination. I shared posters and banners all over in my community so that to have a safer and good community. I didn't forget children. I also went to the schools and spoke with the teachers about COVID-19 vaccination, and all children were got vaccinated in my community. At last now we can have a better community because I have we got the opportunity to be engaged, and my name has changed from Bishi, my name has changed from Woga, and now I am a bingwa, I am a champion.
Right. Right, a very good afternoon to you one more time. Ebingwara! Ebingwara! Cha! Guys, you're not feeling the vibe. We are from the African Union CDC. We are the champions of Africa. We are the bingwas of Africa. We are here to tell you to get vaccinated. When we are all vaccinated, the family members and everybody, we live in a healthy environment. So here are the champions. Let's do it one more time. I want the crowd to join us. Ebingwa! Ebingwa! Bingwa! 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 Ra! Cha! Ma! African Union! Cha! Bingwa! 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 You can be a bingwa. You can be like us. Join this amazing family of young people, vibrant, advocating for change. Engage the family members. Tell a friend to get vaccinated. Because together we make this world a better place to live in. I'm a proud bingwa!
Thank you, John. Thank you. A very last one. Silas, are we good? Okay. Thank you so much, everyone. This is, can I have my mic? Wow, such a guy. Thank you so much. So this is the team, as I mentioned, the very recent has been trained in Dar es Salaam recently to serve as Bingwa in Eastern region. But they're from Kenya, Uganda, Rwanda. It's not all the 14 countries represented here. Yeah, Comoros. Oh, Comoros. Yes. So thank you so much. We just wanted to introduce to you guys the Bingwa team attending the Youth Pre-Conference. Thank you, Ali. Thank you. Bye-bye.
All right. Thank you. Wow. Okay, don't wonder. You know, the energy in the room was very, very good. All right. Bingwas, thank you very much. What Dr. Promise didn't say, that he has he's asked me to say, is that the Bingwa initiative is supported by quite a few partners. The German Development Corporation, GIZ Office to the African Union, is also supporting the Bingwa initiative under the Africa CDC Saving Lives and Livelihoods Initiative. And then, of course, the MasterCard and the various other partners whom you've seen, AMREF, Red Cross, IFRC, and quite a number of other partners. We encourage you to join them. I think that the message is clear. Vaccination is key, is important. We are not yet out of the woods. Just 27%, about 27% of the continent is still the number we have for vaccinated people. And we need to get to 70% to have the herd immunity that is the benchmark. So please, we encourage you to join those initiatives that continue to advocate for vaccination. Ladies and gentlemen, we would skip our networking session and we would do it at the cultural dinner. It will be integrated into the cultural evening. So the colleagues who have put together the plan should not be disappointed. It would happen at the dinner. Right about now, we would move to the closing session for this conference. And for that, I'd like to invite to the stage for the closing session Dr. Jean-Claude Semuto, who is the Division Manager for Research, Innovation, and Data Science at the Rwanda Biomedical Center, on behalf of the Minister of Health of the Republic of Rwanda. Let's put our hands together for Dr. Semuto. Thank you very much for joining us. Let me also, please take your seat. Yes, thank you. Let me also invite my boss and the director of the GIZ office to the African Union, Dr. Tobias Till, who has also joined us for the last few sessions. Thank you very much, Tobias, for joining. Please, let's put our hands together for him as he makes his way. And on behalf of the Africa CDC, Let's keep clapping until Tobias gets to the, or else we'll cancel your tickets. All right. Thank you, Tobias. And of course, on behalf of the Africa CDC, let's invite back the Chief Bingwa, Dr. Chris Promise Kaneki, who would deliver the message on behalf of Dr. Ahmed Ogwell. Well, there is a message they've not sent me, but I can tease you with it. Dr. Ahmed is arriving later tonight, and he's tasked us to make sure that he engages with you before the end of the CPHIA conference. So for those of you who are staying, we would communicate to you what that program would look like. So stay close to your WhatsApp group, which they've shared with you. We would put the information there, and we would also try as much as possible to see whether we can live stream that for those of you who have gone back to also join. And without wasting any more of your time, let me invite four, or maybe let me do this professionally before I invite our panelists for their speech. Ladies and gentlemen, we have now come to the close of our youth pre-conference on the margins of the International Conference on Public Health in Africa, CPHIA 2022, under the theme, Meaningful Youth Engagement for Advancing Sustainable Health Security in Africa. Over the last 2 days, we've had about 200 young participants from about 40 member states of the African Union participate in various sessions that have looked at the role that young people can play in advancing the new public health order, in achieving the Africa Health Strategy, and ultimately to attain a continent that is peaceful, united, and integrated, but also safer and healthier for all of us. We have an outcome statement which is being finalized. This will also be shared with you so that we co-create it together. This draft will be shared with you to make your inputs, and we would have these documents, like we mentioned to you, represented in the speeches of the Director of the Africa CDC at the opening of the International Conference on Public Health in Africa, starting on Tuesday. On this note, let me also remind you, as we've said severally, that you have been supported to take part in the pre-conference. But since we've been saying that you are not just young people, you are a critical part and a huge number of the African population, you also have to be part of the main discussions, and we have supported you to also take part in the conference. We thank all the partners who have been able to put this together, GIZ, of course, our colleagues from MasterCard under the Saving Lives and Livelihoods Initiative, but also to say a very big thank you to the Africa CDC for opening up their space for this initiative. Ladies and gentlemen, at this point, let me now invite Dr. Tobias Thiel, the Director of the German Development Cooperation Office, GIZ Office, to the African Union for his remarks. Dr. Thiel, you have the floor.
Thank you so much, Ibrahim. Dear fellow panelists, dear participants, I have to say I'm really impressed by all the positive energy I've seen here in the room. I have to say it's really something that's quite impressive to see. And I have to say it's a real honor and a real personal pleasure to join you here in Kigali at the closing session of the Youth Pre-Conference, the first ever to the International Conference on Public Health in Africa. This conference has been convened by our close and trusted partner, the Africa Centers of Disease Control and Prevention, and I would like to congratulate them on their strategic leadership in making this conference possible. After 2 years of the COVID pandemic, I believe that this conference comes at such an important time for Africa, because Africa is now at a crossroads to promote its long-term preparedness for future pandemics and health security. This vision, dear participants, cannot be achieved without the leadership of African youth. As we heard yesterday and today, Africa has the youngest population in the world. It's a staggering 70% of people living in sub-Saharan Africa that are under the age of 30. But even beyond these statistics, the discussions over the last 2 days have brought many powerful ideas to the fore, and they have shown how meaningful youth engagement can be. And I'm really impressed by the inspiring speeches we've seen here today, and by, we've just seen it now, the energy of the Bingwa initiative. When it comes to the vision of strengthening health security in Africa, I believe that it's only possible to achieve this if your generation is fully empowered to realize its full potential. And it's therefore crucial that young people such as yourself, and I really mean every single one of you in this room today, engage themselves at different levels. You need to really seize the opportunity to innovate and advance the health agenda in Africa. I guess that as a representative of the German government, of the German development cooperation, it's not my role to instigate African youth to rebel against their parents' generation. But I think the message is still quite clear. You need to empower yourselves to co-shape Africa's public health agenda. Dear participants, health is a shared priority of the German government and the African Union. Through our joint project, Strengthening Crisis and Pandemic Response in Africa, GIZ, the German Development Agency, is committed to support our partner, the Africa CDC, in creating platforms and spaces, such as this pre-conference today, for a meaningful youth engagement in public health. And we hope that the conversations at this pre-conference and the main conference in the next few days will give the much-needed impetus for a new paradigm of a youth-centered public health order. But I believe that we even need to take it one step further. We are very eager to see how you will translate what has been discussed at this conference into concrete action, because only with your leadership we can achieve a safer and healthier Africa. Thank you very much.
Thank you very much, Dr. Tobias Steele, for your very important closing remarks at this session. Now let me invite for his input Dr. Jean-Claude Semuto for the input on behalf of the government of Rwanda. Dr. Semuto, please.
Thank you all. It has been a great pleasure to host you as the Minister of Health. And we are very optimistic that any initiative engaging youth properly is always successful. Even the initiatives that are not doing good things, if they really engage youth properly, they succeed. So we don't have doubt that you are the part of the success of this continent. And one thing that I'm briefed is that young people don't like too much or too long talk. So I will be brief. So on one end, we recognize your potential, your will, and contribution to the health sector in your various roles, researchers, advocacy, awareness, and broad work within the civil society. So we know that you are the catalyst of change. So whenever anything engages youth properly, it will make sure, or it will make a difference. So as the Minister of Health, we really appreciate this initiative, and we are sure that it's going to be as successful as we expect youth to be always successful. So it is great to keep this kind of platform and ensure they are accountable on the work what you are doing, so in your respective country, and also the way of sharing experience. So what works there, in principle, should work somewhere else. So it is really great to exchange this important experience and ensure that what is benefit to one side is also reaching the other side. One other thing that I also mentioned during the panel is to never give up. So it's a very important point. If you want to be successful, don't be afraid to fail. Fail, fail, fail 1,000 times, but at the end, you will be successful. So that is the last point. Please, youth, please, young people, make sure you try and start now, not tomorrow. And I'm happy that we have Africa Union. We have this new Bingwa. So I really like it. Probably I'm a bit old, but I would like really to join. So, I know some of the members are in Rwanda, and probably we connect and see how old people can still join and contribute. Thank you all. Have a nice day and enjoy all your time in Rwanda. We hope to meet again during the conference as well as outside networking. We are very happy of you attending this conference. Thank you.
Thank you very much, Dr. Semuto, for the kind words. Dr. Semuto's endorsement of the Bingwa initiative is coming on the heels of 2 presidential endorsements of the initiative already. His Excellency President Museveni of Uganda had earlier endorsed the Bingwa initiative in July this year. Last month, in October, no, was it November? No, October. In October as well, President H.H. Hichilema of the Republic of Zambia also endorsed the Bingwa initiative. So we welcome the endorsement on behalf of the government of Rwanda, and we look forward to your support for the Bingwas here in this country and those who are also in the region helping to drive the vaccination. Before I invite the last speaker for the input on behalf of the Africa CDC, because this is the last time you will hear from me. Once Dr. Kaniki closes the meeting, no one speaks afterwards. But I want to say a very big thank you to all of you for the last 2 days. I think we've had an excellent outing, and I'd like to thank all the colleagues who've worked with us to achieve this, from the Africa CDC, from the GIZ office to the African Union, but also colleagues from the Ministry of Health here in Rwanda who've worked with us. We thank you very much, all our teams. I will leave that to Dr. Kaniki to handle, but I say thank you. And now, I'd like to invite Dr. Chris Promise Kaniki, Chief Bingwa, Strategic, the technical advisor at the office of the Director of the Africa CDC, for his closing remarks.
I think for this time, I will try to use this mic. Thank you, Dr. Semuto. Thank you, Tobias, for coming, joining us. For this, I think I have 2 segments. first on behalf of the Director of Africa CDC, Dr. Ahmed Ogwe Uma, and maybe also on behalf of the team as we prepare and conduct this event. So on behalf of the Director of Africa CDC, I would like to say thank you to all of you for coming, because if you guys didn't apply first for this initiative and being with us here, this event couldn't happen. So the first word of thanking you is for you guys, the participants here, and this is on behalf of the Director of Africa CDC, Dr. Ahmed Ogwe Uma. And again, he presents again his excuses, because we are trying again for him to join even at this segment of final, closing. But it's happened that he's again on another flight coming to Kigali. So he's arriving tonight. Maybe as Sanusi mentioned, we are going to organize a session for you guys to meet him. So on his behalf, again, congratulations and thank you for coming. Dr. Ahmed Ugwa is very grateful to the Republic of Rwanda for hosting the first ever youth pre-conference, but also to all our partners, the GIZ for the great support, MasterCard Foundation. I think some of the staff are here. No, I'm not seeing anyone, they left. There's another session going on at Radisson. So GIZ, thank you so much to all the team for the support. Sanusi, Wong, Yodit, let me name them. E1 is not here, the one was supporting for tickets. But also the Africa CDC team, allow me please to call them maybe to stand up. Kadebe, Irina, please stand up, Irina. I see Betty's in the room, and Domsani. This is the team that is supported to bring you guys here. But also AFNET. AFNET is supporting us. They are not in the room. So thank you so much to all the team, GIZ, Africa CDC, and AFNET. Without you guys, we couldn't make it. So I'm very grateful for the support that you are bringing to this initiative. As Sanusi mentioned it, the director would like to really engage the team, and we are really looking at, trying to see how we are going to organize this session with the director during the CPHIA. And as I said it yesterday, all of you guys here are welcome to the CPHIA. We are going to make sure that you are registered so that you can be part of all the session at CPHIA. And for those being tonight or tomorrow morning, safe trip back home, and looking forward to meet you again next year. But again, as Dr. Semuto said it here, the deliberation, even some other panelists said it, what we discuss here is not something that is going to end here. This is just where we're starting, and we want you guys to bring it back home. We need you to go and discuss this, and all the input that we are looking forward to receive from you to build this, we are calling the strategic from Africa CDC engaging young people on the continent. So to conclude, I would like again to say thank you, and see you next year to the next CPHIA. I'm not yet authorized to announce when next year CPHIA is going to be. The official announcement will be done, I think, at the main event CPHIA. So we'll get the information there, and then see you next year at the next CPHIA, where we'll be organizing another youth pre-conference. I thank you. And that was on behalf of the Director of Africa CDC. Why are you guys laughing? Now it's Promise talking. Okay, just for us to end the session, I would like to say again, thank you on my behalf for you guys joining. Again, I would like to remember the scan. Please don't forget to join the group as we are going to share the information. Please share that scan again. Guys, it was very wonderful having you here. We tried our best, and I know that there are some of you guys who wanted to be with us here, but we couldn't bring them to join us physically. We hope that next year we will be able to manage to bring more with the support again of GIZ, as usual, but also MasterCard and all other partners who are willing to join us in this journey that we just started. So take this message back home. I know that you have a friend who wanted to be here but who is not here. Please let them know that we didn't just leave them behind because we wanted all of you guys to be here. So next year we are going to bring everyone here. Thank you so much. Please bring our greeting to your respective community and see you next year. Thank you. The session is officially closed.
The buses are available now to take you to your hotels. We reconvene for the cocktail